Today what we're going to go over is consent forms for dental implants. With all consent forms, the first line is always basic patient information verifying the patient name and the date of birth. It is recommended that the patient clearly print their name and their date of birth on these lines. The next section is the description of the form being signed, in this case, the consent for dental implants. It states that it is important for the patient has made his or her decision and acknowledged and consented to the treatment that was recommended by their dentist. It should state that the patient has the right and the obligation to make his or her decisions regarding their own health care. It should also state that the dentist has provided them with the necessary information and advice, but as a member of the healthcare team, you must also, as the patient, be a very active participant in the decision-making process. This form will also acknowledge the patient's consent to the treatment that has been recommended by the dentist. The next part of the consent form explains that it has been specifically stated who will be treating the patient and why. It should state that I request and authorize that the doctor and his or her associates or assistants perform the surgical placement of dental implants upon me. This procedure has been recommended to me by my dentist as an option to replace my natural teeth. The next statement should be a description of what a dental implant is. Feel free to put your own description in here. Basically, what I like to put is a dental implant are metal anchors put inside the jawbone underneath the gum line. Small posts are attached to the implants, and artificial teeth or dentures are fastened to the posts. The next part of the consent form would explain what may be involved in that specific treatment. For example, how many procedures will be required and what the patient will leave the office with. For example, most patients need 2 surgical procedures when placing an implant. The first procedure involves the drilling of small holes into the jawbone and placing the anchors. A temporary tooth or a denture may be worn for a few months while the anchors or implants bond with the jawbone and the gums and the bone heal. The second procedure will be to uncover the implants to allow for attachment of the posts. Also explain that after the posts are in place, the replacement teeth in the form of a fixed or removable bridgework or even a denture are fastened to the posts. Now, depending on the condition of the mouth, bone grafts or guided tissue regeneration also might be necessary to install the anchors and the posts. I also like to point out that the potential benefits of this procedure include the replacement of missing natural teeth or supporting dentures. The next paragraph should verify that the patient has confirmed the implant treatment over other possible treatment options. It should state, I have chosen to undergo this procedure after considering the alternative forms of treatment for my condition, which should include no treatment at all, complete or partial dentures, or fixed or removable bridges. Each of these alternative forms of treatment has its own potential benefits, risk, and complications. The next paragraph is very important because it gives the doctor consent to use anesthesia and other medications during the procedure, and it explains the risks involved. It should state, I consent to the administration of anesthesia or other medications before, during, and after the procedure by qualified personnel. I understand that all anesthetics or sedation medications involved the very rare potential of risks and complications such as damage to vital organs, including the brain, heart, lungs, liver, and kidneys, paralysis, cardiac arrest, and or death from both known and unknown causes. The next paragraph is simply to just reiterate that there are risks involved in this procedure and that there is no way to guarantee if this patient will or will not have any of them with their particular treatment. It should state, I understand that there are potential risks, complications, and side effects associated with any dental procedure. Although it is impossible to list every potential risk, complication, or side effect, I have been informed in some of the possible risks, complications, and side effects of this particular dental implant surgery. It is important on these consent forms, regardless of the procedure, to put as many possible risks involved and possible side effects involved with the treatment. For example, in consent form for dental implants, we should put the possibility of post-operative discomfort and swelling, possibility of bleeding, post-operative infection, injury or damage to the adjacent teeth or roots of the teeth, injury or damage to nerves in the lower jaw, causing temporary or even permanent numbness and tingling of the chin, lips, cheek, gums, or tongue. Now, because the patient has to have their mouth open for an extended period of time, it is important to let them know on these consent forms that they may have restricted ability to open the mouth because of swelling and muscle soreness or stress on the joints in the jaw, also known as TMJ. It's possible that they could fracture the jaw, have bone loss in the jaw. If the dentist is going to be placing an implant in the upper right or the upper left quadrant, it is important to let the patient know that it is possible that there could be penetration into the sinus cavity. Also, there could be mechanical failure of the implant, post, or the attached teeth. There is also even a small percentage, that the implant itself could fail. Also, there could be allergic or adverse reaction to any medications that the doctor prescribes to the patient during or after the procedure. The next statements explain to the patient that even though dental implants are 96% plus successful, there is no way to guarantee that their results are going to be successful, or if they will have any of these side effects or complications that we have previously listed. It should state that most of these risks, complications, and side effects are not serious or do not happen frequently. Although these risks, complications, and side effects occur only very rarely, they do sometimes occur and cannot be predicted or prevented by the dentist performing the procedure. Although most procedures have good results, I, the patient, acknowledge that no guarantees have been made to me about the results of this procedure or the occurrence of any risks, complications, or side effects. It should also state that these potential risks and complications could result in the need to repeat the procedure. The implant may need to be removed, or you may need to undergo additional dental, medical, or surgical treatment or procedures, hospitalization, or even blood transfusion, even though that these are very rare. Also state that very rarely the potential risks and complications could result in permanent disability or death. It should also state that the patient recognizes that due to the course of treatment and unforeseeable conditions may require additional treatment or procedures. It should also state that the patient has requested and authorizes the dentist and/or the assistants or other qualified medical personnel to perform such treatment as required. The next paragraph or statement is extremely important, as it says that the patient has read and understands what they are going to have done and understands the potential risks, all of the complications, and all of the side effects that are involved in this procedure. It should state, I certify that I have read or had read to me the contents of this form. I have read or had read to me and will follow any patient instructions related to this procedure. I understand the potential risks, complications, and side effects involved with any dental treatment or procedures and have decided to proceed with this procedure after considering the possibility of both known and unknown risks, complications, side effects, and alternatives to this procedure. I have also declared that I have had the opportunity to ask questions, and all of my questions have been answered to my satisfaction. Now, the last page or section is the most important of all. This is where the patient or the legal guardian must sign the document, thus stating that they have read and understood the consent form and have given authorization to proceed with this particular treatment. It is always good to have a witness, such as a doctor or staff member, who has verified it was in fact signed by the person responsible for this procedure, whether it be the patient or a legal authorized guardian, if the patient is underage. Also, please make sure that this is a signature, not a printed name of the patient or the legal guardian. The legal guardian and the witness can either sign or print their name on the following lines. If a legal guardian is signing on behalf of the minor, it is important to make sure that the relationship is stated. Also, that the date that the document was signed by both the witness and the patient or legal guardian.